Good day. We are Group 5 from CRN 24025, and the topic we chose is multiple sclerosis. Our group members are Donald Primus, Selena Ragunanan, Bina Ramkisoon Singh, Usha Ramphal, and Leanne Ross.
Introduction. Multiple sclerosis, MS, is a chronic autoimmune disorder that affects the central nervous system, damaging the protective myelin sheath around nerve fibers. This disruption leads to symptoms such as vision problems, muscle weakness, and coordination difficulties, first described by French neurologist Jean-Martin Charcot in 1968. MS remains widely studied, with research pointing to genetic, environmental, and lifestyle factors as potential contributors. Understanding its causes, symptoms, and treatment options is essential for better management and improved patient outcomes.
Good day, everyone. My name is Selena Ragunanan, and I'll be doing the causes of multiple sclerosis. Multiple sclerosis occurs due to the breakdown of myelin, a protective sheet surrounding nerve cells in the brain and spinal cord. Myelin plays a crucial role in transmitting signals between the brain and the rest of the body, controlling functions such as movement, sensation, and vision. In MS, the immune system, which typically defends the body against harmful invaders like bacteria and viruses, mistakenly targets healthy myelin and sometimes the nerve cell beneath it as a threat. While the exact cause of MS remains unclear, research suggests several factors may increase the risk of developing this condition. Factors that may increase the risk of MS are age. MS most commonly develops between the ages of 20 and 50. Gender. Women are 2 to 3 times more likely than men to develop MS, suggesting hormonal factors may play a role. Genetics. Having a close relative, parent, or sibling with MS slightly increases the risk. However, MS is not directly inherited. Smoking. People who smoke are twice as likely to develop MS. Smoking is also linked to more severe disease progression. Vitamin D levels. Low levels of vitamin D and reduced exposure to sunlight are associated with a higher risk of MS. Studies suggest that the season of birth may also play a role, possibly due to maternal sun exposure during pregnancy. Obesity. People who are obese or were obese during childhood have an increased risk of developing MS. I'll now pass you on to my colleague Usha to continue.
Hi, so I will be continuing with latitude gradient. Multiple sclerosis is more common in areas farther from the equator, suggesting a link between sunlight exposure, therefore vitamin D levels, and disease risk. For example, people living in northern Europe or North America have higher rates of multiple sclerosis. Ethnicity. People of Northern European descent are more susceptible to multiple sclerosis, whereas it is less common among people of Asian, African, or Indigenous American ancestry, though rates may rise in these groups if they migrate to high-risk regions supporting environmental influences. Gut microbiome. There is also growing research in how the gut microbiome, the microorganisms living in the digestive tract, may influence multiple sclerosis. Imbalances in gut bacteria may affect immune function and contribute to autoimmune activity in susceptible individuals. I'll now pass you on to Bina, who will continue the presentation.
I'll now introduce Bina and Leanne, who will be doing the 4 symptoms associated with multiple sclerosis.
Symptoms associated with multiple scoliosis. Symptoms of multiple scoliosis vary from individual to individual depending on the extent of the damage to the demyelinated nerves. MS symptoms include fatigue. Fatigue affects around 80% of individuals with multiple scoliosis, often being sudden, exacerbated by heat and disproportionate to activity levels. Unlike typical tiredness, this primary fatigue results from demyelination and neuronal damage, which disrupts neural signaling and energy metabolism in the central nervous system. Management strategies for MS-related fatigue. Energy conservation. Managing fatigue through energy conservation involves pacing activities and incorporating regular rest periods to prevent excessive fatigue and maintain energy throughout the day. Medications. Medication like amantadine and modafinil are commonly used to manage MS-related fatigue. Cooling strategies, wearing cooling vests, or using air conditioning are helpful measures to lower body temperature, reduce fatigue caused by overheating, and improve comfort and mobility.
Vision impairment. Vision impairment is one of the first signs of multiple sclerosis. This is, of course, upon consulting with an ophthalmologist who examines, tests, and eliminates other underlying conditions. MS can lead to damage of the myelin sheath of the optic nerve, causing inflammation and vision issues. Depending on the extent of damage to the nerve fibers, MS patients may recover their vision, then face relapses. The following optic disorders are related to MS. Optic neuritis, which is the inflammation of the optic nerve, this results in partial vision loss in one eye, pain during eye movement, blurred vision, dim or loss of color vision. Diplopia or double vision. This is a result of weak eye muscles that can no longer coordinate eye movements. Nystagmus or dancing eyes. This is the uncontrolled rapid movement of eyes up and down, side to side, or rotating. Muscle impairment as it relates to spasticity, weakness, mobility issues. A common denotation of multiple sclerosis is the impairment of muscular function in terms of functioning capacity, weakness, and slowed movement. This is physically observed as stiffness or involuntary muscle movements. Spasticity is a state of increased muscular tone whereby abnormal stretching increases muscle resistance. Muscle spasms by the forceful activation of leg muscles are also observed as progressive MS. According to Joy J.E. 2001, the CNS damage caused by MS disrupts communication, allowing the persistent contraction of the muscle fibers that produce spasticity. Spasticity may be presented as flexor spasticity. This is when muscles tighten, limbs bend, and it's difficult to straighten. Extensor spasticity. This is when muscles tighten, limbs are straight, and it's difficult to bend. Muscle weakness can occur in any part of the body of a MS patient. Damaged nerve fibers in the spinal cord and brain cannot transmit nerve impulses to muscles, leading to underused muscles, thus reducing activity level, slower metabolism, tiring quickly, and subsequently joint issues and imbalance. Advanced symptoms involve weakness to both lower limbs, weakness to only one lower limb than the other, or weakness to one lower limb and an upper limb.
Cognitive impairment. Cognitive difficulties affect 70 to 40% of people with multiple scoliosis, making it harder to remember things, stay focused, solve problems, and process information quickly. These issues occur due to damage in the brain areas like the prefrontal cortex and hippocampus, which are responsible for memory and decision making. Common cognitive challenges in MS include memory problems, trouble recalling recent events or learning new information, attention difficulties, struggling to focus on tasks, especially complex ones, slow thinking, taking longer to process and respond to information, executive function issue, difficulty planning, making decisions, or multitasking. Cognitive impairment management strategies, cognitive rehabilitation therapy, structured mental exercises to improve memory and focus, medication, drugs like tenofovir have been studied, but their effectiveness is still uncertain. Lifestyle changes, regular exercise, a healthy diet, and mental activities. Assistive technology, tools like digital reminders, voice recorders, and task management apps make daily tasks easier.
Good day, my name is Donald Primus, and today I'll be talking about the description of two interventions. While there is no cure for MS, there are treatments that can help manage the disease and its symptoms. These treatments can be broadly classified into the following categories. 1. Disease-modified therapies, DMT. DMTs are the cornerstone of MS treatment. They work by reducing the frequency and severity of relapses, slowing the progression of disabilities, and preventing new lesions from forming in the brain and spinal cord. There are many different DMTs available, and they are typically administered through injection or infusion. Some common examples include interferon beta, IFNB. This medication helps to regulate the immune system and reduce inflammation. It is available in several forms, including IFN-B1A, Avonex or Rebif, and IFN-B1B, Betaseron or Extavia. Glytamera acetate, also known as Copax-1, this medication is thought to work by mimicking the myelin basic protein, which is a component of the myelin sheath. It may help to protect myelin from further damage. Another form of intervention, lifestyle and rehabilitation. In addition to medication, there are several lifestyle changes and rehabilitation therapies that can help people with MS manage their symptoms and improve their quality of life. These include exercise. Regular exercise can help to improve mobility, fatigue, and the overall quality of life. Dieting. Eating a healthy diet, such as a Mediterranean diet or a low-fat diet, may have neuroprotective effects. And last but not least, physical therapy. Physical therapy can help to improve strength, balance, and coordination. Please note it is important that you work with a healthcare team to develop a comprehensive treatment plan tailored to your needs. This treatment plan should include medication, lifestyle changes, and rehabilitation therapies. As you can see from the slides, rehabilitation therapies in multiple sclerosis. We have physical therapy, we have speech language therapy, there is occupational therapies, cognitive rehabilitation therapies, as well as others.
Multiple sclerosis remains a challenging and unpredictable disease, but ongoing research has shed light on its causes and ways to manage its effects. While the exact origin of multiple sclerosis is still unknown, various factors, including genetics, environmental influences, and lifestyle choices, are believed to contribute to its development. Recognizing early symptoms such as vision impairment, muscle weakness, and coordination difficulties is important for early diagnosis and intervention. Though multiple sclerosis presents significant challenges, disease-modifying therapies, lifestyle modifications, and rehabilitation programs offer hope for managing symptoms and slowing disease progression. Continued research and awareness are necessary in the fight against multiple sclerosis. Through education, medical innovation, and a commitment to improving patient care, those living with multiple sclerosis can find strength and resilience in their journey living with multiple sclerosis.
We hope you enjoyed our presentation on multiple sclerosis. Thank you for your time and attention.